evening and welcome to the People's Platform. Breast cancer is the most common cancer among women, locally as well as globally. In Sri Lanka, 15 women are diagnosed with breast cancer on a daily basis. In Sri Lanka, 3 women die of breast cancer every single day. But breast cancer is curable. How do we equip ourselves with the knowledge, awareness and skill set to overcome breast cancer? Let's find out. Tonight we'll be discussing early detection of breast cancer. We've invited to our studio Dr. Nisanka Jayawardena, Consultant General Surgeon and President-elect of the Sri Lanka Association of Breast Surgeons. Good evening and welcome, Doctor.
Good evening.
We've also invited to our studio Dr. Lanka Disanayake, Chairperson of the Indira Cancer Trust. Good evening and welcome once again, Doctor.
Thank you.
My first question is to Dr. Nisanka. Cancer is such a scary word. Can you help us deconstruct and demystify cancer and specifically breast cancer?
Yeah, the word cancer is, associated with a lot of fear and a lot of myths. Historically, with the treatment which was available some decades ago, cancer was not curable. So that stigma has been there, but now with the advent of new methods, new knowledge, new skills, new medicines, most of the cancers, if they are detected early, are curable, totally curable. And breast cancer is such a cancer where generally cure can be expected for about 90 to 95% if detected in time and proper treatment is given. So we have to spread this message to the people, to the society, so that they will come forward and they will look for the proper treatment, and they should be given the information about how to get it, and such treatment is available free of charge in the government sector, and sometimes if you can manage, you can go to the private sector and get your treatment. So it is available. All the necessary modern treatment for breast cancer is available in Sri Lanka, and our cancer survival is also fairly better than rest of the South Asian countries.
Okay, thank you very much. Dr. Lanka, you are the chairperson of the Indira Cancer Trust, which was started in 2016, and since then the trust has played an instrumental role in creating awareness surrounding breast cancer, in conducting a multitude of workshops, programs across the country. Speak to us about the vision and mission of the trust. Speak to us about the kind of work that you engage in towards this.
Sure. And I think to start off with, since it's Breast Cancer Awareness Month, let me just begin why we as an organization, we have so many cancers. So why did we choose breast cancer as our main cancer? To educate the masses on early detection. As Dr. Nisanka said, this, and as you said, it's the largest number of women get breast cancer, and this is a cancer, if detected early, we can completely cure. I think that's the take home message. And yet you may ask, why do we see so many patients? At the trust we do many programs, we support patients, we support family members, and when we analyze the patients that come to us, we see the majority of them are breast cancer patients, and they have come and seen the doctors at a later stage. So this prompted us as an organization about 3 years ago to start this aggressive campaign for breast cancer awareness. You see, starting from our uniform, which is totally pink, we also observed the Pink Wednesday, which was started by Mr. Roshan Mahanama. So we don't confine ourselves to October to talk about breast cancer. We do that throughout the year. And with that, we also do many activities, including supporting education. We also support patients who have side effects from treatment that they get. For example, for not only for breast cancer, with chemotherapy you may lose your hair, with breast cancer you may lose a breast. So we do programs which are provided for patients free of charge. We provide wigs, we provide breast prosthesis, we help with economic upliftment, livelihood support, and so many services are available which people can access. But our main thrust in terms of early detection is on breast cancer, because it's something, as a country, it's the highest cancer, highest overall cancer, and if we do something about it, we can definitely see results. So I think it's something we should all invest our time in propagating the message.
Thank you. Dr. Nisanka, when we speak about surgery, women fear losing a breast. Women fear the loss of their body image, the traditional conception surrounding beauty. Can you take us through what surgery entails? Also speaking to us about conservative breast surgery and reconstructive surgery.
Basic target of surgical treatment of the breast cancer is mainly surgery is primarily done for early breast cancer, where the cancer is fairly confined to the breast. Basic target of any cancer surgical treatment is to remove, if possible, all the cancer cells.
Right.
So historically, if you take, it was Sir Halsted, William Halsted, in late 19th century, started a thing called radical mastectomy, where they took off the breast, the underlying muscles, and all the associated things close by. So which was a very disfiguring operation. Then later they found out there is no difference between if you just simply take the breast off and doing this nasty operation. So gradually the surgery for breast cancer has becoming less and less radical or less and less severe. So now we are actually aiming at what you said, conservative breast surgery, where you aim to conserve the breast. So there are various techniques which are called oncoplastic techniques. Onco means cancer, plastic means plastic surgery. So oncoplastic techniques, where sometimes the outcome of the appearance is better than the early one.
Right.
So because generally there are things called symmetrization surgery, where you can do once you do the surgery for the breast cancer, you remove that part, but the shape and the proportion of the breast may be looking better or younger than the previous, the original, and then you can match the same thing with the other breast. Now other countries, of course, they use it, but here, of course, the demand for that is very little, because our ladies are not that keen on that type of cosmetic. But still, we can give them a very good, fairly justifiable result. So actually, people who undergo, the only thing is the fear. When they get to know there's something, the cancer is in the breast, they just want it out, and they think this is going to kill me, and I want it out. So they want the whole breast to be out, and also sometimes they don't want any reconstruction also. They don't want anything which looks like the breast also. So they are so depressed and scared. But they have found out now, in certain studies, conservative breast surgery invariably has to be associated with the radiotherapy, where you give radiation to the breast after surgery. The results of the long-term results, longevity as well as the disease-free time, sometimes may be better than the traditional mastectomy.
Right.
So, most of the cancers, as Lanka said, if we detect it in time, when it is in a when you can nip it in the bud, the result is very good, and the disfigurement is very good, very less. So, I think otherwise, if you have to, in rare occasions where there are certain conditions, you have to take the whole breast off. Then of course, there are ways of reconstructing the breast at the same time of the operation, which is called at the same, you operate and then the patient wakes up, the breast is still there because you are reconstructed, and or they can get a reconstruction later. Once the disease is settled, then treatment is over.
Thank you very much. Dr. Lanka, women in South Asia, women in Sri Lanka in general tend to put themselves behind, deprioritize their own needs, as a result of which, even if a woman were to find a lump on her breast or some sort of abnormality, she would postpone it to attend to her husband, to attend to her children or her job. So there is something wrong with our mindset, our psyche. As a result of a delay, it could prove fatal. Speak to us about this trend in women, since you see patients on a daily basis.
I think you're absolutely right. As women, I think it is in our culture. If you take a family, you would see, the wife normally eats last, could be. I mean, that is kind of culturally inherent in us. Females tend to be very giving. They always put the family members first. So this is something that we have been addressing, and this is the exact reason that when you're talking of breast cancer, for a man who has a woman, I mean, every man has a mother. They could also have a sister. They could have a wife, they could have a daughter. So men have a big responsibility to play. It's very difficult to change a woman's mindset because of the way we have been nurtured. We have, I don't know what it is, but it's a very giving nature. But for women also, one of the key messages is when you neglect yourself, because we see so many patients walking in, when we have a chat to them, yes, the first point is they don't examine themselves. Suddenly you're faced with a situation where they may have a lump, there could be some discharge, there is a change. Then they don't go to the doctor immediately, and then when we inquire why, okay, no, my son had a graduation, so I had to wait for that. My daughter was going through an exam, my husband was going through a very difficult time at work, so I can't put this pressure on the family, so I waited for things to settle, and then they go to the doctor. So that delay is deadly, because we have seen situations, had they gone a couple of months earlier, maybe they sometimes delay even years, things could have turned out far differently. And I think, as Dr. Nisanka mentioned, the severity of the surgery, the life, because if you detect the breast cancer early, you can actually get 100% cure. So why are we losing out on this this opportunity? And also for a woman as well, if you fall down, I mean, the woman is the center of a family, a mother, a wife. If you fall down, the whole family collapses. This is what we see. And we always ask ourselves the question, why does it happen with cancer? I mean, we get enough diagnosis, people get heart attacks, people get chest pains, people get diabetes, arthritis. It doesn't happen with that. So why is it only with cancer? So I think for women, the key message is, if you do find something abnormal, please don't wait for other things to settle. It is your duty to look after your family, yes, and as part of that duty, you must seek medical help. That is a must, because otherwise it's a crime. Something you can nip in the bud, you're keeping it for it goes into situations where your life could also be affected. So it's something we should all take very seriously, and the first step towards that is actually examining yourself monthly, which takes a few minutes. And if you do that, I mean, there are enough literature on the web, there's enough literature on how to do it. It's not a scientific thing, you can do it standing, sitting there. I mean, so many in the era of technology, it's information is out there. It is up to us. The smartphones are there, calendar alerts are there. So once a month, 7 days after the beginning of your periods, you set a date, or if you're menopausal, you just fix a date that you remember, and you fix that date and you do it. It takes 5 minutes, not more than 5 minutes. And if you do find something abnormal, you must seek a doctor. And again, it's the woman's responsibility, but as men out there, please make sure that your wife, your mother, your daughter, everyone does this, because at the end of the day, not doing it will have repercussions on the whole family.
Absolutely. Dr. Nisanka, with a cancer diagnosis, initially the oncologist could tell the patient, "Gihin current allalena, light allan," so which is radiotherapy and or chemotherapy or both, and these are viewed with so much of fear because of mainly hair loss and other side effects that you face. So the very word current allanama, it has a negative connotation. So the stigma surrounding the treatment of cancer, speak to us about that and what we can do to change mindsets.
No, actually, it's the way you talk to the patient. You have to, it's a very fine balance between telling the truth and not upsetting the patient as well. So with experience, you gain it, and you have to be. There should be empathy, and you should, you should not be sad but empathetic, and you have to talk to the patient kindly and be honest with the patient. It's always better if she has someone when you are breaking the bad news, and always you must tell the patient of the real situation, and then the best outcome, how she can get the best outcome. Generally, the treatment of breast cancer, I'm not talking of the screening of breast cancer. The Lanka said all these things. Treatment of breast cancer generally is decided with a multidisciplinary team.
Right.
So this team classically involves a surgeon, an oncologist, radiation oncologist, then a pathologist,
Right.
radiologist, and then there are specialized nurses. In other countries, it's quite common. You get breast care nurses, and so many other specialties as well, like psychiatrists, occupational therapists, so many patients, people. So all these people, generally the basic, the triad is the pathologist, radiologist, surgeons, and oncologist. There are 4 people. Main 4 people will get together and then get the information of the cancer. So once the cancer is diagnosed, you do what is called staging of the cancer. Once the cancer is diagnosed with a thing called triple assessment, where there is a lot of technical jargon. Triple assessment is the X-rays, which is mammogram, and ultrasound scan, then the clinical examination, and then the test where you look at cells, either histology or cytology. So with these results, you put these results into the forum of a multidisciplinary team, and then you get ideas of all the doctors who are there to decide how best this patient should be treated. So it's actually tailor-made treatment for each patient. It is not a standard treatment where you come with a breast cancer, you do a mastectomy. It is now out.
Okay.
So if you come with a breast cancer, or let's say someone comes with a breast cancer, that cancer will be assessed. One is the stage. Stage is one is the you diagnose the cancer, then you stage the cancer. Stage means how far it has gone. Then you type the cancer, how bad this cancer is, what is the type of this cancer, what drugs and what treatment methods the cancer would respond to. So all these things are now available. So all these things are put together. Then we decide on a treatment. So treatment may be, depending on the situation, first surgery, and then go for other treatments, adjuvant therapy, which is very important to complete the treatment.
Okay.
And or sometimes this committee will decide first go to the adjuvant therapy, radiation and chemotherapy, and then get the size of the cancer reduced, and then go for surgery. So there are so many ways. It's very complicated, but it's very effective.
Okay.
I think main thing is that the amount of time you spend with the patient,
Right.
and being friendly and talking nicely to the patient, and then give her courage to face this situation.
Yeah, Doctor, but empathy isn't the most common trait that we find in government hospitals especially.
No, the thing is, government hospitals, now I have been working in government hospitals for nearly 30 years, and generally for the common people, I mean, there are some one or two incidents you hear in newspapers, but generally the patients are quite well treated in government hospitals.
Okay.
And I think maybe due to overcrowding and all, in certain cases there may not be, you may not spend enough time with the patient.
Yeah.
But of course you don't get cancer patients like that. You get cancer patients 1 or 2 a day. So I think any doctor who is treating cancer patients should spend time with the cancer patient and then explain what is happening to her and what are her chances and what she can do, how comfortable her life is. So all these things has to be discussed with the patient, any cancer patient or any status of the community.
Women tend to be very disconnected from their own bodies because we are taught from a very young age to associate shame around our bodies, and we're not taught to honor and love our bodies. So this is the main cause for not detecting, not identifying any abnormalities. If we are to shift the script, how must we work on this TLC campaign that you speak of? Explain this 5-minute self breast examination to us clearly so that our viewers will also benefit.
Okay, I think you touched on a very sensitive and correct point in that viewing of the correct image we portray. Now, even the word breasts is not spoken out loud very much. I mean, it's just one part of a female body. So it has a very clinical note to it.
Yeah.
And I think we see things, or society sees things in a different way.
Yeah.
I mean, even if you asked me to explain about it would have been easier just to give you a clip art image of how to do it.
Right.
But again, on media, you cannot show those things. So this is something we have faced. But so there are certain restrictions. It could be because of our cultural system. It's also the education system.
Yeah.
One of the main things is these are points that need to be spoken of at a very young age.
Absolutely.
So adolescents, we need to talk about it. The curricula needs to have it. So those things really need to change. And examining your breast should not be viewed as something different. I mean, you get up in the morning, you brush your teeth. That's a very normal habit to be doing. So same way, every month examining your breast should be normalized. So this is why we talk of it at every opportunity we get. I mean, the act itself, I mean, the National Cancer Control Program has early detection program. Then the colleges, various professional colleges, they speak of it quite often. And the way to do it, I mean, there are enough items on the social media, on the internet to look at that. But basically what you do is the TLC campaign, what it focuses on is TLC. I mean, normally we use those mnemonics for tender loving care. I mean, we relate that to a woman and we ask them to touch, look and check. So basically touch is you use your fingertips, you touch the breast and you feel for differences. It could be a lump, it could be the skin, it could be some swellings, anything out of the ordinary, you feel for it by using your hands. Then the look is you look at your breast. It could be the symmetry, it could be some differences in either breast, it could be the shape, it could be the nipple. So you observe. So you use your eyes to see, you use your hands to feel, and with these two actions you might find a difference. You might and then what you do is C stands for check. So you find a difference, you must go and seek medical help. There are also, I must say, there are a lot of concerns from the the experts who practice medicine, in that we do see a proportion of people who seek other forms of treatment. So that is also a concern that is expressed. There are standard treatments for cancer, as Dr. Nissanka mentioned. You know, there are protocols, there are guidelines available. So if there is any abnormality, we ask you to seek medical help from the nearest available facility. There are enough government institutions, there are emerge clinics where they have well women clinics every Wednesday. Then also there are early detection centers. The Association of Breast Surgeons, they have set up, and the College of Surgeons, they have set up free clinics. I mean, National Hospital also has a free clinic where if you find something abnormal, it's on a Thursday, you can walk in. So there are facilities available, and of course all the private hospitals also have it. So the summary of the whole question that you asked is the body image issue. Examining your breast is just another act, and that it should be made to feel like that rather than anything special. And the act itself is a very simple procedure where you use touch, look, and then if anything abnormal, you seek medical help.
Dr. Nissanka, can you take us through the early detection framework in state hospitals?
Now there are 3 forms of cancer screening. Now in Sri Lanka, the incidence of cancer is not as high as the West.
Okay.
While in the West it's about 1 in 9, in Sri Lanka it's about 1 in 25, 22. So we don't need I think if you can afford, being a poor country, I don't think we can do mammograms for all women like in the West. All women mammographic screening, which is the most effective screening, done once the woman is around 40 years, every 2 years, 2 films of mammography for every woman. But here we have to make a little bit of adaptation, I think, for our situation, like I mean incidence, lower incidence, we can say low incidence, lower incidence, and also our economics. There are 3 ways of screening. One is most important, as Dr. Lanka suggested, self breast examination. So that is called SBE, self breast examination. So that is the most important thing. Then you can have a thing called clinical breast examination. So where the lady is encouraged to go to a trained professional, maybe it's a midwife, or maybe it's a doctor in a peripheral hospital or in a dispensary or a private physician, so that he can do a systematic methodical examination of the breast.
Right.
So that is encouraged to do about 6 months, once in 6 months.
Okay.
Other thing is, of course, mammographic screening. So mammographic screening standard is to do 2 views of mammograms, and ideally to be reviewed by 2 independent radiologists. But that is I mean, even if you can get 1 to this thing, that's okay. Now that is, I think, if you can afford, it's always better to have a mammogram once you are, let's say, at least 50 years old, or maybe 40-45 years old, because in our experience we have seen and in certain studies also have shown that breast cancer increases with age. In most of the times, young children 15-14 come with breast lumps and with fear of cancer, and 99.999% it's not a cancer.
Okay.
Right? So they don't have to be that scared. But when the lady becomes, a woman becomes more than 30-35, the risk of cancer increases. So and so at around 40 years, I would say our incidence is slightly, the peak starts slightly before the West.
Okay.
So our women peaks a little bit earlier. So I think for this country, my personal view is we better to start around 40-45 at least to have a mammographic if you can afford. But there are certain instances where you are high risk.
Okay.
Mainly the family history. Family history is the most significant risk factor.
Okay.
Apart from the age, of course everybody knows the age. More older you are, more prone to get breast cancer. But when your family has close relatives, that is first degree relatives like your mothers or sisters, and the second degree relatives like grandmothers or aunties, they are more prone to get breast cancer. So these people should have screening, mammographic screening, in my opinion. And also certain people who undergo various regimes of treatment, like let's say hormone replacement therapy, HRT, before that better to do a mammogram, because certain hormones may induce or may encourage the growth of breast cancer, because as you know, breast cancer is all dependent on estrogen. So if you give estrogens, it might encourage people to grow breast cancer. Therefore, in certain levels, your doctor will know that whether to have a mammographic screening. But I would encourage all women to have a mammographic at least once around 40-45, and then once in every 3 years at least, if you can afford. Otherwise, if you are high risk, I think you have to do a more stringent screening procedure.
Right. Okay. That's very comprehensive. Thank you. Dr. Lanka, hair fall is one of the side effects of cancer treatment, like radiotherapy and chemotherapy. This affects one's self-esteem and standing in society. How does one overcome this? How does one strengthen one's mind? Can you speak about also the mental health aspect of it? Because I think that plays a key role also with the recovery process.
Definitely. I think one of the main fears, if you talk about breast cancer, if you talk to a patient who has been told that they have breast cancer, is there are 2 fears that come to their mind. I think one is losing the breasts, and the second is losing hair. And what all these actions basically translate to the fact that you lose the womanhood of a female, which is considered sacred. I mean, in cultures like ours, hair is considered sacred. It's considered as a symbol of beauty. So losing that, a woman loses the confidence. And sometimes people go to the extent, and we don't seem to understand sometimes we tend to ignore that fact. But losing hair is so important that sometimes when they are given the diagnosis, they said they don't want to go through the treatment because of the side effects. So that's actually a crime. because this is such a temporary measure. I mean, losing hair is a temporary thing. You will get your hair back after the treatment is over. It will take some time. I mean, it takes about maybe 6 months, a few months for it to grow back. But some of the things which we fail to understand, where we started we have set up wig donation program. So we have we were collecting hair earlier with Ramani Fernando salons, and we collect the hair and we convert them to wigs, natural hair wigs, and then we give it out to patients free of charge. We've been doing that since 2017, and we see so many people walking through our doors, and when you hear them and when you speak to them, you understand the impact of hair loss. So it's not a factor that we should take very lightly, because sometimes you get asked the point, okay, why are you trying to beautify a person with cancer? You know, just help them with their medicines. But cancer is more than that. When you physically, when you change, when you get asked questions from society about why they have changed. And also, I think Dr. Nisanka mentioned a very apt word, empathy. Cancer tends to create a lot of sympathy. I mean, this is not something a patient would like. I mean, we are trying to create a society where anyone having cancer should be able to walk down the road without being asked too many questions. So, but this doesn't happen. So, it will take some time for society to accept that, and until such time, I think we provide wigs free of charge. That normalizes them. And we also, I mean, we also need to understand, I mean, it's not only young patients who come to us, we get the older ones. So, we do make grey hair wigs. So, you may tend to ask, okay, why does an older woman want a wig? I mean, is it for their beauty? No, it's just to lead a normal life. They may want to go to the temple, they want to go to their religious place, they want to go and meet other family members in a public place, they may want to see their grandchildren in school. So, all these things, because of the way the society reacts to a person without hair, they need to make themselves more in line with the others that you call normal. So, that is a fear of losing hair, but there is enough support available. If you do need a wig, please, you know, please come to us. We are at Indira Cancer Trust. We are just next to Apeksha Hospital, Maharagama. Everything is given free of charge. We also send wigs out to 10 different hospitals throughout Sri Lanka as well. And you know, so the support is there always. So, please don't delay treatment because of hair loss. It's really not worth it, because it's a temporary thing, and we will help you go through that phase without hair. And quite rightly, as you mentioned, the mental strength of with which you face the disease, extremely important, because unfortunately cancer has this negative term associated to it. You know, it's not a death sentence. It's not something that you need to take it in the spirit of negativity. So, what we say is, okay, you have a disease, fine, you know, we take treatment promptly, and then we help you to get through that difficult time, be it the support services like a breast prosthesis. If you lose a breast, I mean, now the prevalence of losing a breast is less, because you tend to go for breast conservation surgery. But if you do lose a breast, we do provide you with a free, you know, again a breast prosthesis bar, which is done by one of the leading Bobby Industries here. So, we give it out free of charge to anyone from Indira Cancer Trust. And also livelihood support and many other services. You know, you need to be economically stable. You need to, because cancer tends to affect them in many ways. So, we are there with our services to help them, but facing the disease head full on with a positive mindset, definitely, you know, it basically creates an atmosphere where the healing process is accelerated.
Dr. Nisanka, can you speak to us and share your perspectives on breast cancer prevention and holistic wellness?
Yeah, breast cancer prevention, when you talk about breast cancer prevention, we must talk about the risk factors of breast cancer. There are certain avoidable risk factors and there are certain unavoidable risk factors. So, unavoidable risk factors would be, you know, your family history, where your parents, you can't change that, your genes. In that case, your only hope is, I mean, what you should do is, I don't say only hope, but you should do is you have to be more careful and do the screening.
Yeah.
So you're talking about primary prevention. So when primary prevention is to prevent breast cancer from occurring, so then there are risk factors like overeating, lot of fatty foods, smoking, alcohol, then certain hormones which are not taken according to medical prescriptions, and of course exposure to radiation and so on and so forth. Then again you can avoid that. Other aspect is secondary prevention, where you will prevent the disease becoming more severe.
Right.
So that is, I think, with the screening you will attain that, because you are diagnosing the disease at a stage where it can be treated very well without nasty effects. And also breast cancers has a certain precancerous lesions, like one of that is duct carcinoma in situ, where the cancer has not spread but it is there. So diagnosing of these also can be easily done, can be done with mammography and the other assessment. Other thing is, when you are looking at the society, we have to give knowledge, we have to impart knowledge to the target population. Now target population will be mainly, particularly the girls. The girls will become women, and they are the people who are more prone to develop breast cancer because they have more tissue, breast tissue in their bodies. So we have to educate them, I think, from school days. We have to seriously tell them what is breast cancer, what are the risk factors, how you should be careful about it, and how, if you develop by any chance, what you should do. So all these things, and the real aspect of breast cancer, how to face it.
Right.
So these things, I think, should be taught at the school stage. That is what I think, because then eventually when they become the adults, and they'll know how to face this problem.
Dr. Lanka, about 10 years ago, when I lost a loved one to cancer, something that I was grappling with was the lack of support groups to grieve, to compare notes, to talk about what to do, which psychiatrist or which psychologist or which counselor to go to. And I think that's a huge void in Sri Lanka. Have we made any progress?
I think it's quite apt subject, because today morning we had a multi-stakeholder breast cancer workshop, and Dr. Nisanka was also there, various professionals were there, civil society groups were there, and one of the main topics that we discussed was lacking was again the support groups. There were organizations, I mean one organization was Mithuruwala, who had support groups, but if you look at the Western countries, the support groups play a huge role, and there is a void, and as organizations working in cancer, I think it is something we have to seriously look at, and we are hoping that this month being breast cancer month, we are hoping to set up at least one breast cancer support groups. Now support groups help each other in so many ways, because you meet patients who have gone through similar circumstances to them. This gives them confidence. I mean, it's easy for a doctor to be talking about medical condition, but you have to be in their own shoes to understand what they are going through. And also family members. Family members need to talk to others also about their grief, about the difficulties. So we do need it, and counseling is a major support system that we should have. At Indira Cancer Trust, we do have a counselor in-house who sees patients who walk in, and every day, I mean, sometimes in Sri Lanka, again, it's another cultural thing. Counseling is not seen very positively. It's seen as a sign of mental illness, but counseling is a support system that everyone could do with. So, it is again a support system that needs strengthening, and there are the organizations as civil society groups working in this. We are looking at establishing formal support groups so that we can help more patients. We are also looking at, with the era of technology, there are options of online things plus also physical thing, because again distances, travelling costs have different implications. So, it should not be a Colombo based one, but at least to start off with, we should definitely initiate support groups and strengthen that, so that they are able to talk within the peers and understand the disease, understand the support mechanism, and also understand what family members go through.
Dr. Nisanka, you also work as the President-elect of the Sri Lanka Association of Breast Surgeons on this aspect of support groups, cancer support groups. Do you think this is a cause that you could advocate for, so that at least from the budget there can be some sort of budgetary allocation for this purpose, as it's important?
Yes, I think this is the most important thing, one of the most important things, because once the treatment is over, and also before the treatment, because once the diagnosis is given, the woman is devastated, and support groups can come, be very useful at this stage throughout the treatment, because most of the now abroad, of course, they have volunteers where they will come and with the people with successful treatment, they will come and meet the patient, and then they will tell, this is what happened to me, and this is nothing to worry, your hair will fall off, nothing to worry, it will come back, you will have a rough time, you don't have to lie to the patient, you will have a rough time ahead, but that is temporary, and then you will have a good result. So, to encourage. Other thing is to support them with the diagnostic facilities. If they don't have enough money to, sometimes we have scarcity of cancer drugs, anti-cancer drugs, then the support the relatives. Some people don't have a place to stay when they come to Apeksha hospital. Provide them with shelter. There are so many things where support group. One good thing about our country is, we are the country of givers. Its only thing is we have to divert it properly. So, people will come, people will flock together to give. So, if you properly manage it, we can have lot of support groups. I think it's very important to entire life of the cancer patient.
All right, fantastic. Thank you so much, Dr. Nisanka Jayawardena, Consultant General Surgeon, and Dr. Lanka Jayasuridisanaika, Chairperson of the Indira Cancer Trust. Thank you so much for taking the time to share your expertise and perspectives with all of us. Thank you.
Thank you very much.
Thank you for watching us. We'll see you again next Tuesday with a single edition of the program. Good night.